Donald Trump is at the centre of the latest health scare in the United States. He's repeated a claim that paracetamol, sold under the name of Tylenol in the United States, is linked to autism in children. The US president has gone as far as advising pregnant women not to take the drug. Now, no doctor backs Trump's claim. In fact, American gynecologists and obstetricians say that it is safe to take.
Thank you very much.
In a move that shocked many medical experts, US President Donald Trump issued new guidelines, advising pregnant women to avoid Tylenol, also known as paracetamol or acetaminophen, asserting that it causes autism.
I just recommend strongly that you don't use Tylenol unless it's absolutely necessary. But this is a very strong recommendation, maybe stronger from me than from the group, because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it. Much, Bobby, please.
The decision was backed by the US Health Secretary, Robert F. Kennedy, who's known for his controversial medical views, including an anti-vaccine stance. Trump ordered Kennedy to determine the cause of autism, which is a complex condition that's been researched for decades, within 5 months. After re-evaluating existing studies, the US administration now claims that paracetamol use during pregnancy is to blame. But many doctors are sceptical, saying that it's difficult to prove a causal link from the data, as any correlation between its use in pregnancy and autism could be caused by the condition prompting a woman to take the medication.
There are so many reasons people take acetaminophen in pregnancy. So is it the acetaminophen, or was it the fact that the patient developed a fever from something else that led to the problem? Is it the fact that the patient has potentially maybe an autoimmune disorder that causes pain, and so they take acetaminophen for pain?
Guidelines already exist advising women to take the drug sparingly during pregnancy, and the World Health Organization has rebuked the US president's claims.
The evidence remains inconsistent. Several studies that have done after that have found no such a relationship. It is important that every woman continues to follow the advice of their doctors or health workers who can help assess individual circumstances and recommend necessary medicine.
The organisation also dismissed claims that vaccines can lead to autism, saying that no link between the two has been found through scientific research.
Let's get more on this and bring in Lawrence Gostin, Director of the WHO Collaborative Centre on Global Health Law. Lawrence, thanks for being with us here on France 24. We appreciate your time. Is the President of the United States then disregarding science completely in what he's saying?
I think it's an utterly reckless set of comments that the President and the Health Secretary made. There have been many studies of both the link between vaccines and autism, and also acetaminophen and autism. And there's been, no causal connection demonstrated. In fact, although some studies show a weak correlation, at least 2 high-quality studies have demonstrated that there is no known causal relationship, and the president seems to be making it up as he goes along. Politicians shouldn't be, doing science. That's for scientists and public health professionals.
And this has great implications for global health security, clearly, because what the US president says doesn't just play in the United States. It goes around the globe, doesn't it? And lots of people in lots of countries listen to what the president of the United States says. So when Trump says this, it could have a much wider effect further afield.
Yeah, just think back to COVID during President Trump's first term, where he would just get up and say things that were just silly, like let's try bleach for COVID-19. This is not much better and very, very dangerous. He's just shooting from the hip.
And when Trump says to pregnant women, for instance, they should just tough it out rather than take the drugs. You mentioned COVID, of course. When Trump had COVID, he received something like, I think the ballpark figure was $800,000 worth of treatment in order to get himself better. Again, something which you said was just like a cold. One day it'll just go away.
Yeah. Well, yeah, he did get the state-of-the-art treatment that most Americans at that time could never have gotten. Now, here's a bizarre thing. The National Institutes for Health in the United States just announced a $50 million research grant to study the causes of autism. It seems to me the president and the health secretary got it backwards. You're supposed to do the research first and then come to the conclusions later. You don't come to the conclusions and then launch the research. I really do feel, and I don't say this lightly, that the White House, the health secretary, can no longer be trusted in terms of matters of public health and healthcare and science.
And it seems, and again, I'm a layman, so I'm just putting this out there, and you can give us an assessment of what I'm saying. It seems this comes from the same kind of playbook as the vaccine skeptic, and obviously sort of don't get vaccinated against measles, that kind of thing, which leads to a sort of growth of outbreaks of cases.
Yeah, a lot of this is disinformation, misinformation. It borders on and probably are related to conspiracy theories. But if you look back, particularly at the health secretary, Robert F. Kennedy Jr., he was the world's leading vaccine skeptic. He made tens of millions of dollars knocking vaccines. He ignores science, and as head of the Department of Health and Human Services, he's fired all the credible scientists and hired loyalists and people who have known records of being of really ignoring science and evidence. It's a very, very sad day for us in the United States, and I think around the world, as you say, when it comes to science and public health.
I wish I could put this to Trump, but I can't. I'll put it to you, sir. Where are they getting this from? Because he has people who are advising him, people behind him. You mentioned RFK Jr., but there are people there who have a voice. Where are they getting all this from?
You know, I really think they're getting it from social media and hunches and long-held ideologies. If you really want to find out what the state of the science and art is in relation to autism, you know, ask pediatricians, ask scientists at CDC, ask the American College of Gynecology and Obstetrics, or the National Academy of Sciences. I don't know where he's getting his information, but it's certainly not from people who have knowledge and expertise in science and public health.
Lawrence Gostin, Director of the WHO Collaborative Centre on Global Health Law. Thank you, sir, for joining us. Thank you for sharing your thoughts very frankly with us about Donald Trump's claim that paracetamol sold under a particular name, Tylenol, in the United States could be a cause of autism. Lawrence Gostin, thank you for joining us.